Hi everyone, my name's Dr. Laura Byrne. I'm a consultant in HIV medicine at St George's Hospital, and I'm also one of the two admissions tutors for both of the medicine courses at the university.
Hi everyone, my name's Bex. I'm one of the fourth year medical students, and I came into St George's via the undergraduate program, so I came straight from high school.
Hi everyone, I'm Ratna Romi. I've just finished my final year of the graduate entry program at St George's.
Great, thank you very much. You'll hear more from Bex, Laura and Ratna further on. What we're going to do is start with an overview of the course presentation, which I'm going to start, and then Laura will pick up the admissions bits later on. And then we hope to finish that by around 20 to 5. And then our students will say a bit from their point of view, and then we should hope to have at least 15 minutes time for question and answers at the end. So I should have said I'm also a consultant neurologist in the trust next door, George's Trust. So let's just... So what I'm going to do is give a very brief introduction to St George's. We're one of the oldest medical schools in London. We've been training doctors since the 1770s, originally in Hyde Park Corner, but obviously things have changed a lot over the years, especially since we moved to the site here in Tooting in the last century, indeed, where there's been a lot of development since then. But we have a very long history in training doctors. One of the things that's changed quite apart from the move to the George's site is, of course, our approach to equality, diversity and inclusion. And I mentioned this early on because we take great pride in the progress we've made in terms of widening participation and embracing diversity and equality in all aspects and inclusivity. So in the early days, there would have been very few female medical students at all, for example, whereas now over half our cohort is female. We have a very broad range of cultural, religious, ethnic backgrounds, and a very proactive approach to supporting students with reasonable adjustments and disabilities. And currently we also now have the first female Vice Chancellor of the university. And you can read a lot more about the university approach to equality and diversity on our website, the link for which is shown there. So why do we think George's, what are we offering you? Why do we think that people who want to be doctors should come and train here? Well, what we offer is a truly transformative education. It's not just about learning the anatomy, the physiology and the skills and things. You will change as a person through our program from the day that you start to the day that you graduate. And we know that our graduates our program produces confident, resilient doctors who are ready to work with colleagues for the benefit of our population. So they're really ready to join the workforce. And we get really excellent feedback from partner trusts and providers on the quality of the doctors that we produce. And we know that our students are then equipped to provide really excellent, compassionate care. And it's not just about being able to do that at the point of graduation. You also need to develop as a learner through the program so that from graduation onwards, you're also equipped to adapt to rapidly changing science and society. So your learning and development as a doctor never stops. When I qualified, MRIs didn't even exist. Now they're the bread and butter of neurology. So you have to, and things like AI and digital training and online, all of these things have happened in my lifetime and they were not available at all when I graduated. So you have to be able to not only meet the skills and the requirements at the point of graduation, but we have to also train you to be able to adapt to rapidly changing science and society, because that's the nature of the job that doctors are going to be involved with. And how we achieve that is that we put a great deal of emphasis on values-based recruitment, because being a good doctor is not just about having the best science A levels or the best, being the brightest or the quickest. It's much more than that. It's about having the right skills and values and the potential to demonstrate those. We do a lot of work around effective team working through our case-based learning and problem-based learning. That is modelling team working, because that is also a fundamental requirement for being a good doctor, and training in an interdisciplinary way. And throughout our programme, we embed learning development as well alongside the other traditional skills and knowledge that we think doctors need. You can look on our website as well to look at the journeys of some of our alumni, going both historically and more recent. I'm not going to go through all of these now, but just as an example, Helen Stokes-Lampard is one of our alumni who ended up as the president of the Royal College of General Practitioners and subsequently the president of the Academy of the Royal Colleges, Medical Colleges, which is really one of the very senior roles in the UK. We also have Leeds Mohammed Akhtar, who've played a big role in equality and diversity nationally in the medical workforce. We have leads such as Frank Chigunwadu and Timothy Ho, who got awards in New Year's Honours lists for roles in COVID and so on. And you can look on our website and see the sort of journeys that some of our alumni have had in all areas of medicine. I can't talk about George's without talking about Tooting. For anyone who hasn't visited the area on first arrival, it might be a bit of a surprise, but I can tell you it is an incredibly vibrant, diverse and exciting place to live. I live and work in the area, as do many of our staff, so that there's fantastic food markets and local shops, very multicultural, diverse society. We're very much embedded in the community of patients that we serve, and we pride ourselves on that. There's Tooting Beck Lido. I'm not in that photo, but there's a fantastic open air Lido. There's a excellent common at Tooting. You will see me doing park run most Saturdays. There's lots of fitness and other things around in the area. So it really is a fantastic area to live and study. And it's easily accessible for central London and not so far in town that it's difficult to get out either. We would encourage students who are successful in getting a place here to try and move into the area to get the best out of your university experience, and also, of course, cut down on any sort of commute time. So coming on to the programme itself, we have two entry streams. So we have the 5-year stream, which has 2 clinical science years, and we have the 4-year graduate entry programme, which has 1 clinical science year, and we refer to those as MBBS 5 and MBBS 4. On both programmes, the course structure is that in the clinical science years, this is largely campus-based, but it is patient-centred from year 1. So on the M5 programme, you have case-based learning. Everything is centred around cases. And on the M4 programme, it's problem-based learning in year 1 in the clinical science years. Both streams then merge at this point into let me just get a laser pointer going, into what we call the transitional year. So year 2 for M4, year 3 for M5, and it's transitional in that it's the time when both cohorts come together and become completely mixed up, and there are real advantages to that in terms of shared learning. It's also transitional as you start to do more placement-based learning. There is some clinical experience in the early years as well, which I'll say more about later, but it's really in the transitional year that you start to get more consolidated blocks shown in green here of clinical placement experience alternating with campus-based activities. And then when you move into the final 2 years, the clinical practice years, penultimate and final, it is nearly all placement related. So out on placements in primary and secondary care and community placements, learning from patients. And certainly by this stage of the programme, you need to have really evolved some of those self-directed learning skills and to be able to take advantage of the opportunities that are available. We have a flexible approach to intercalation, so nobody has to intercalate, but students can do an extra year either for a BSc or between the penultimate and the final year for a master's programme at any of these points during the training. And there are, again, a lot of advantages in doing that. There's no rush to becoming a doctor, even though that you think there might be. A lot of students really benefit from that additional year, and it could be a good opportunity to test out career hypotheses, to test out whether you might want to be someone involved in research and teaching and leadership, all those sort of other things alongside core medical practice. So talking about the clinical science years, in both the structure for clinical sciences is essentially the same for both M4 and M5, but the M4 course, the graduate course, it's all condensed into 1 year, so it's really quite intense, whereas for the 5-year stream, you're doing this over 2 years. But in both arms of the programme, there's an initial introductory or foundation module where you sample a little bit of information from each of the main life modules. And the rest of the programme is structured around these life modules. And these are sort of theme-based. So, for example, life control covers the mind and brain, so neurology, psychiatry. But at this stage, we're starting with the basic and clinical sciences. Life structure, for example, is musculoskeletal and skin and so on. Life cycle is fetal development, childhood, pregnancy and older age. Life protection is infection and immunity. So they're all structured in sort of modular groups. So in the foundation, you will cover a bit of content from all of these areas, and then you go into more detailed modules. And this is the start of our curriculum approach, which is a spiral integrated curriculum. So although we talk about modules, at the end of the day, you've got to have covered everything, and you have to be assessed on everything at that level. So throughout the programme, we start at one level, build on it at another level, and then you revisit it in more depth and breadth as you move through the programme. So across each of these modules, there are 3 main themes. There's professional skills, basic and clinical sciences, and patients, populations and society. And I'm going to say a bit more about each of those. So basic and clinical sciences is what most people think of sort of automatically when they think about the early years of medical school. So it's the factual knowledge, the anatomy, the physiology and so on, but understanding the structure, function and development of the normal human bodies at all levels, from the molecular right through to the whole individual. And also, once you've understood the normal, starting to explore the changes that occur as a result of disease, injury or abnormal development, and getting into factors that affect the outcomes and treatments of those various conditions. So that's what we mean by basic and clinical sciences. Patients, populations and society is another very important strand, because you're dealing with humans, and humans function in society, and so you also need to understand the psychological, social, family, cultural context of patients and how those factors can influence disease and treatment and outcomes. And within this strand, we start to introduce you also to the basics of things like epidemiology, understanding the public health, starting to understand research methodologies and statistics, and how you critically appraise published literature. And we will start to also introduce other themes which are important for future doctors around understanding leadership, quality and service improvement, and working in teams. There's also some taught content around some of the ethics, the medical law, regulation of medicine and so on, all of which you need to have an understanding of in the early years to start putting into practice when you go into your clinical placement years. And all of this speaks to starting to understand more than the science, but the professional duties and the perspectives needed to be a doctor. And we have 3 specific leads who work across all years of the programme, looking at research, looking at healthcare leadership and management, and looking at quality improvement, which includes sustainability, by which I mean environmental and financial sustainability, because it's a responsibility of doctors to take a role in promoting that as well, and that's now outlined by the GMC. When we talk about skills, so this is the 3rd domain that you cover in the first 2 years. So you've got the basic clinical sciences, patients, populations and society. When we talk about professional skills, we're talking about the clinical skills. So this is learning how to examine a patient, how to listen to a heart, percuss a chest, feel an abdomen, and communication skills. So how to elicit a history effectively, how developing a range of communication styles to adapt to the patient in front of you, learning empathy and critical listening and all of those sort of skills. So we will teach you all of those things in simulation and in practical sessions. There's also a whole range of procedures that you have to be able to do by the time you graduate. So this is things like doing basic observations, blood pressure, heart rate, testing urine, and then they build in complexity. So taking blood tests, doing arterial arterial blood glasses and so on as you move through the program. So we start introducing those skills right from the beginning, and as a matter of principle you will practice the skills in simulation first before you then go out and have to practice them in a supervised environment on patients. We also have this whole assessment domain called Becoming a Doctor, which is about demonstrating that you can put into practice the behaviours and the knowledge that you've covered about what it means to be a doctor. And again, I'll say a bit more about that later on. But this includes demonstrating reflective practice, that you are constantly learning and looking at your own learning styles and being proactive about the learning environment, that you're developing these teamwork and leadership skills. So we embed throughout the programme ways to help you develop those skills. And then, of course, we have to assess them as well. So how do students learn? Well, in the campus side of things, of course, we have lectures and seminars and tutorials. We place a lot of emphasis on small group learning in the early years. That does very much model and help you develop those team working skills. So in the 5-year programme, it's case-based learning. In the 4-year problem, it's problem-based learning in the 4-year programme. But the time you get into the transitional year, everyone does problem-based learning, because that, again, helps you develop those self-directed learning skills. And there are a number of other small group tutorials. Some of them are in person, some of them are on site. Most of this is in person on site. Alongside lectures and seminars and tutorials. You'll have dedicated simulation, clinical and communication sessions throughout the programme in the early years. And we have a recently refurbished anatomy suite with a lot of plastinated models and some really fantastic 3-dimensional anatomage interactive tables to use, which are a really excellent way of demonstrating anatomy in a 3D visual way, which those of you who've come to open days will do in the future might get to see. We also have expert forums throughout the programs where you might hear from expert patients and from specific clinical experts or charity experts in the fields. And there are visits, both general practice and other community visits like the local sickle cell centres in the early clinical science years. And as I mentioned at the start, our whole curriculum is integrated around clinical cases from week 1. And of course, throughout this, it's also very much informed by student feedback. We do have a number of student selected components throughout the programme as well, where you have an opportunity to explore in more depth an area that interests you. We use a lot of technology. We have an excellent learning environment, Canvas. We video record all our sort of didactic lectures for revision purposes. And to support students who have specific learning needs. We have virtual patients in the transitional year for problem-based learning, where you can practice in a remote environment making clinical decisions on patients. So if you get it wrong and you kill them, at least it's only a virtual patient that you've killed. We have a number of embedded, massive open online courses, and we have a new portfolio which we're moving to this year, PebblePad, to help capture things like your work-based assessments and procedures and skills and any other things that you do along the way. We encourage people to be interactive in lectures and tutorials using tools like Mentimeter and Kahoot. And our library has a very vast online resource, as well as some on-site resources for click and collect in hard copy. And then last year, the 23-24 academic year, we launched George, our new curriculum map. So this is a web-based app which all our students can access, where you can see in real time all of the learning objectives and the practice outcomes, depending on which placement you're on. You can make notes on it, you can mark things as ticked or not, and our clinical teachers can see it as well. So it's a really fantastic resource. It means you can see exactly where you are on your journey and what you still need to do to meet the outcomes for that year. And you can also, if you want to, look ahead and start to see a bit more about what's coming. It is although we do some online and virtual and some asynchronous learning where you're doing your own self-directed learning, it's important to emphasize this is a full-time program. So students need to be available Monday to Friday, 9 to 5, from the get-go in the early years. And as you go through the course later on in the programme, there might be some out of hours work as well, including weekend shifts or evening or overnight shifts. All of our small group and skills and practical sessions are on site. Our lectures and seminars, there's a mixed modalities. Some are live online, some are on site. As I said, the didactic lectures are pre-recorded, but that's really for revision and backup purposes. It's not with the intention that you don't attend. 100% attendance is expected, and we do monitor that in a range of ways. In the clinical science years, then you can expect to be on site between 3 to 4 days a week. Some weeks it'll be a bit more, some weeks it'll be a bit less. And I say the scheduling is around those sort of hours, with Wednesday afternoons protected for the most part for student societies and sports. The actual contact time might vary, but it's important you are available, and that you, if you are given self-directed learning, you often need to do it at that time in order to be prepared for the next session. For the clinical practice years and any of the placements in the early years, which includes some 2-week blocks for the 5-year programme, then the contact time is basically 80 to 100% time, because you're in contact with clinicians, with patients and with others. So again, full-time attendance is expected. And our assessments, our summative assessments, about which I'll say more later, are all on site and supervised, so none of those are remote. I've spoken a bit about intercalation already. I'll just say a bit more about what's available for students who might be thinking about this. So we offer a range of biomedical science programs within George's currently. Students can also apply to go externally, so they might do 2 or 3 years here and then go and decide to go to Manchester or to Imperial to do a particular intercalated degree for a year before coming back to finish their programs here. And as I said, you can also do a master's between the penultimate and the final years of the program to add to your portfolio before you start clinical practice. And you can look on our website about the sort of research that we have particular strengths in here if you're someone who thinks you might be interested in a research career. Now, all of this, of course, is changing. I'll say a bit more about the potential merger, the upcoming merger with City. But one of the expectations from that merger is that the range of internal intercalation that's going to be available should be expanded to include things like leadership, healthcare leadership. They have some biotechnology and computing and things. So there's real potential for expansion there. Now, when you get into the, as I've mentioned already, transitional year, it's a mixture of campus-based in the same format as I've covered already, and clinical placements, and then the last 2 years are clinical practice years. And when it comes to the T and the last 2 years of clinical practice, the approach to learning is a bit different. So we have a core conditions list, which is mapped to the National Medical Licensing Assessment, and this is where George, our curriculum management system, really comes into its own as well, because you need to be opportunistic in your learning. You don't know what patients are going to be in clinic or in outpatients or on the ward that day. You have to be able to flex to what's available. We set you very clearly defined clinical practice outcomes with work-based tasks and activities for any placement that you're on. And these are also formative work-based assessments. So you might be given a particular task that when you're on the medicine firm, you need to do a case discussion around a medical patient. And then that's all of that evidence is collected in the e-portfolio and contributes to the evidencing your professionalism and engagement over the year. And the becoming a doctor domain is very much about immersive experiential learning. And this is demonstrating that by engagement on placement, and we get feedback from your placement supervisors, and being able to show that you can behave professionally in practice. That's where it really comes into its own when you get into the clinical practice years. So in T year, as I mentioned, you will have alternating blocks of campus-based, which will be lectures, tutorials and problem-based learning, and they alternate with clinical placement. So every student will do a medicine, a surgery and a GP placement in the transitional year. These are 5-week blocks currently. And then there's also a substantial student selected component block in T year where you can do a range of things, including data collection, audit or medical education projects, that sort of thing. When you get into the penultimate year, it's nearly all clinical placements, as we said. So we have 4 rotations of 10-week clinical blocks with a week of teaching from clinical staff at the start to kind of front load. So we pair these with obs and gynae and paediatrics, neurology and psychiatry, medicine and medical specialities, which is care of the elderly, and cardiology, and surgery and surgical specialties. And so you will spend pretty much the whole year out on placement. Now, our placement sites in the early years are all pretty local. By local, I mean George's, Epsom and St Helier, Kingston, Croydon, and we also have a few students who go out to East Surrey in the transitional year through a minibus. When you get into the penultimate year, we start to use further afield placements. Now, if you're at a more distant placement, places like Royal Surrey or Ashford and St Peters, Maidstone, Dartford, any of those placements, you would be given accommodation at the placement for the time that you're there. For these more local ones, you need to be able to commute to them from your base. You do get travel and accommodation expenses, either from the university or from the NHS bursary, but you need to think about that when you're planning where you're going to live in terms of your base, that you need to be able to commute to these places. And then in final year, we've actually got a few even more distant sites, which again, you would have accommodation provided at those sites if that's where you're allocated to. In final year, by the time you get to final year, you've pretty much covered all of the content at the end of your penultimate year. The only new content you get in final year is some emergency department experience, some critical care and anaesthetics placement, a bit more public health, and a simulation week for some particular skills and procedures that you have to be able to do in order to graduate. So most of final year is taken up with 3 assistantships. A lot of schools only offer 1, we offer 3. So you will do an assistantship where you're shadowing a junior doctor and practicing being a doctor in medicine, in surgery, and in primary care and general practice. And then we have 2 further SSC blocks, student selected component blocks, one rotating through the year, and then one after the exams, which is the elective. And again, this is an opportunity to go and do a placement of your choosing, or something completely different, something like a leadership project or a medical education project. There are opportunities to do that. And in the elective, the second one, then students, of course, can go anywhere in the world for that. I have to talk about exams briefly. Our principles are that the way medicine is assessed is very, very different from anything you will have done either at A-levels or in a university. It's a very different approach, and that's true at all medical schools. So you will have, because we recognise that it's a big change, so we will always give you a formative, a test exam before the first time you do a summative exam, one that actually counts to get you used to the environment and give you an idea of how it works. All of our year-end summative, we have year-end summative assessments in every year of the programme, and they're all, the written papers are all sat online on site on a university computer with a lockdown browser, and they're invigilated. And we have 3 broad domains. We have one on professional knowledge, which is essentially a written exam, and these are single best answer exams. So you might have 200 questions. It's a kind of multiple choice question, but it's a bit more sophisticated than that, single best answer. So you'll do that at the end of every year of the programme. In the early years, there are also some short answer questions in some of these papers, and in the final year, there's an additional prescribing skills assessment that our students do. And of course, all our students from next year onwards will be sitting the National Medical Licensing Exam, which takes exactly the same format. So that's how the knowledge is assessed. Your professional skills are assessed using a clinical competency assessment, which some universities call an OSCE, or and if you are invited to interview here, you'll get a flavour of what that's like, because our multi-mini interviews are a bit like that. It's multiple stations where you rotate round and practice demonstrating skills. You'd be given clinical scenarios. And then we also have this becoming a doctor domain, where we look at measures of attendance, professional behaviour, your formative work-based assessments, how you've done on your special study components. That is formative for the first year on the M5 programme, but for every other year it's summative, and there's no compensation between the domains. So if you pass these 2 domains, knowledge and skills, but you fail on professionalism, you will not be allowed to progress progress to the following year. And the same applies anyway round. You have to be a rounded individual and be able to demonstrate all of these skills to progress and ultimately to be a doctor. And that's as defined by the GMC. So I'm going to hand over to Laura now for the next 10 minutes or so to talk about admissions. I can do the slides if you just say next slide, please, Laura.
Brilliant, thanks very much. Next slide, please. So the entry requirements for both of our courses are on the website, and so I'm not going to go through them in detail because I've only got a few minutes, but do check the website, particularly if you've got entry requirements that are non-A level. So for the 5-year course, we want 5 GCSEs at grade 6, which is a B or above, including English, language, maths, and either double or triple science. And for A levels, our minimum offer is 3 A's, including chemistry and biology. And your A levels need to have been done at your first attempt and over a 2-year period. And once you meet our entry requirements in terms of either your degree or your exam results, then we look at your UCAT score. So we have a minimum in each section for UCAT, but the cutoff for interview varies each year, depending on how many people apply and how many places we're looking to fill. But to be completely transparent, because we try to be as transparent as possible with our admissions process, we have published all of the previous year's UCAT scores for both, well, it's UCAT for M5 and it's GAMSAT for the 4-year graduate entry course. We published the cutoffs for the previous 5 years on our website. So if you look at the page on the website called Admission Statistics, it tells you how many places we've got for both courses, how many people we interview, what the UCAT and the GAMSAT cutoff scores are. So if you want that kind of information, please do look at our website. Next slide, please. So there are obviously loads of alternative qualifications for M5, and I can't list them all, particularly for obviously international applicants or people that have done, qualifications other than A levels. And you should be able to find yours in the list on the website. And if you can't, you can email the study@stul.ac.uk, and that's the student recruitment team, and they will be able to answer any questions about any other qualifications that you're not sure about. Next slide, please. So for the 5-year course, we have a contextual admissions process, which is we take various pieces of information about you, mostly from your UCAS application form. And there are 3 groups that you could fall into for contextual admissions, and one group in particular can then be eligible for a contextual offer. So that could be an offer which is up to 2 grades lower than our standard offer of 3A. So an offer could be as low as ABB. In order to be eligible for a contextual offer, you have to meet 3 of 5 criteria, which again are all listed on the website. And they are mainly criteria to do with your postcode, so where you live. So this is for school leavers only, not for people who already have degrees, by the way, the contextual offers. For school leavers, if you live in a postcode which has low rates of progression to higher education, or you live in a postcode with high rates of deprivation, or you attend a school with low average A-level results and low progress to higher education, then you could be eligible for contextual offers. So if you do think that you might fall into one of these groups, then please look at the website again. Sorry, I feel like I'm repeating myself, but there's a lot of really detailed information there, and that you can inquire with the student recruitment team who can give you further advice on that. Next slide, please. So for the 4-year course, obviously we are looking for graduates. So you need to have either a postgraduate or an undergraduate degree, and an undergraduate degree needs to be a 2-1. Obviously a postgraduate degree is just a pass. And we are looking for you to have studied and sat the GAMSAT exam, which is knowledge, it has some knowledge-based elements into it. And again, you can have a look on our website to see what previous scores we've used for interview invitations. Next slide, please. That's the same slide. Oh, there we go.
No.
So work experience very briefly. So obviously historically, applications to medical school have required clinical work experience. So people often getting, like a family friend or someone to get them into a hospital or a GP surgery. We don't think that that is a good way of widening participation in medicine, because it obviously involves having contacts. And we also don't believe that clinical work experience is entirely necessary for applying to study medicine. What is really important is some kind of work experience where you've got experience of team working, communication, maybe difficult situations. So this kind of work experience could be working in Tesco, it could be volunteering. And we will, in the interview, which, as Hannah said, is a multiple mini interview, you may well be asked about how you would manage a particular situation, or you might be asked about your experience of working in a team or something like that. So we do want you to come to the interview with some kind of work experience, but it doesn't have to be clinical work experience. Having said that, we do also want you to have a realistic understanding of what life is like as a doctor. So that means what it's like working in a clinical environment, how to balance your responsibilities, what kind of challenges doctors might face. And you can get that kind of thing from reading books, reading magazine articles, watching documentaries, and there have been several filmed at St George's Hospital. So you can get that in really a variety of ways, that realistic understanding of life as a doctor. And as we've said, we do multiple mini interviews because we feel that that's the fairest way of interviewing you. So what that means is there are several different stations set up around one room, and you rotate from one to another, and there's an independent assessor at each station, which means if you fluff up one question, you move on to the next when the timer goes off, and the next interviewer has absolutely no idea that you fluffed up the first question. So each one is independently judged. They could be just a simple question about your experience, it could be a scenario that someone gives you, or it could be a role play or something like that. MMIs are very widely used in medicine, and you could even get something like an exercise or a video to watch, or some universities use writing tasks, so they can be very varied stations. Next slide, please. So I think this is my last slide. These are my top tips for your multiple mini interview at George's. So my first one is just please read the question. So at George's, you can read the question on a laminated card, but also the interviewer will ask you, the assessor will ask you the question out loud as well. And it's really important that you don't assume you know what the question's about, hearing the first few words, that you really do read it and you really understand why we're asking you that question. We really want you to come to the interview with examples from your life. So this is where the work experience comes in. So please, when you're doing your work experience, maybe keep a reflective diary, some way of reflecting on your experiences in your at work, whether it's volunteering or wherever it is, so that you come to the interview with some good examples of where you used your communication skills, for example. Make sure that you can reflect on alternative perspectives. That's always a really big thing. And it's really good to practice answering these kind of questions, because it's not something necessarily that comes naturally. So it's really good if you can get some practice questions off the internet. There's loads of them around. And practice with your friends, your family, even in front of a mirror. Just practice formulating an answer to one of the common questions. But don't over-rehearse. We don't want things learned off by heart. We want you to be authentic and enthusiastic. And if you learn anything off by heart, probably you'll answer the question wrongly, because you won't quite have got the gist of the question. And secondly, you won't come across in a kind of enthusiastic way. So do prepare, but don't over-prepare. And be honest about yourself. Medicine's a broad church. We're looking for lots of different kinds of people. You don't have to pretend to be someone that you're not. But obviously, we do want you to be enthusiastic and understand what life's going to be like as a doctor, to set you up for success on the course. I think that's all my slides. Yeah. Oh, you're muted, Hannah.
Okay, there we are. Just move that out of the way. Yeah, if you're not aware, then we are about to merge with City University. It's based in central London. It's just up the Northern Line. People think it's geographically difficult. It isn't. It's a very easy journey. And we will become a new City St George's from the 1st of August. This is a genuinely exciting opportunity to join a combined institution. And currently, we're a small specialist health university. We will now be a part of a large health school within the new City St George's, and that gives us a much bigger voice in the sector generally. City don't run a medical degree at the moment, and they've made it very clear they're not planning to make any changes or do anything substantive. George's Medicine will still be based here at St George's, because one of our key selling points is our co-location with the major teaching trust. So that's not expected to change. You will still get the same excellent teaching taught by subject experts, practicing clinicians, and you will still be at a university that is absolutely committed to health education as part of a bigger practice and professional education remit. It does mean that between now and when you enroll, there might be some changes largely to some of the broader cross-university services and facilities, but you will always be kept informed. And the nature of medicine, as I said earlier, is about adapting to change, and that happens throughout universities as well anyway. There's some FAQs on the website, and if you do apply, you will be contacted and kept up to date with any specific issues, and you can sign up to an email newsletter as well about that. Let's just, why is this not working? Right, so just to finalise, to say, as I said, we are currently a small specialist health university. We will still be a specialist health faculty, School of Health and Medical Sciences, within the bigger City St George's, and will be a very substantial player in the field then. The medical programme will still be very much here co-located with the major teaching hospital. We have a very modern adaptive course. We use a very wide variety of teaching methods and technology, and you will continue to be taught by people who, like myself and Laura, who are practicing clinicians who really care about developing the workforce for the future and about patient welfare. And we're really passionate about medical education. And as I've said earlier, you'll be able to study and live in a vibrant, diverse, community embedded London occasion. So if you do choose to apply, all the very best of luck. And I'm going to stop sharing my screen there, I'll stop sharing and hand over to, I think our students are coming in to say a few words now. Ratner and Bex.
Hello. I guess I'll go first. So, hi everyone, my name is Ratner Romy. I was on the 4-year graduate entry course. I've just finished my final year now, so I'm actually going to start work pretty soon. I'm actually a home student, and throughout my time at St George's, I actually lived at home and commuted into uni for lectures and placements. So, really, from where I live in East London, it took me about 40 minutes at best each way, and I used to do that every day, although it was less so during the pandemic when I had my first year. Occasionally when we had placement in London, it would be ranged from sometimes as quick as 30 minutes to up to 1.5 hours for me to get into uni placement, but that was fine. And then as the years went on and placements sort of moved further and further out, I ended up taking accommodation for that, but that wasn't really any difficult for me. My background is actually, I did a master's beforehand in like genomics, and I had a bit of a research background, and ironically I just realized doing that I didn't actually like lab work and I preferred the clinical side of it, which was what my project was on. And I thought, well, medicine's probably a better choice for me then. And George's in particular kind of had a really hands-on course that appealed to me. I just kind of like being able to sort of get stuck in with patients, tiptoeing away, sort of trying to deduce what's going on and helping people get better. And I really like the fact that George's like get you doing that from the first year. So, and I mentioned even in my first year, there was like it was the height of the pandemic essentially. One of the highlights for me was that they still got us trying, with social distancing, trying to get into clinical teaching, communication skills, which I liked, and they made an effort to still get us having GP placements, even if that was like over Teams on a phone call, to try and get your confidence up. And I felt that really helped me when it came to the transitional year the next year. Like I kind of had an idea of how to sort of deal with patients or what to expect when you're actually starting to work on the wards, which I really, really appreciate. So at St George's. In terms of being on the MBBS 4 course, it's pretty full on. So as Professor Cox said, it's 2 years in one for the first year. You're going straight to the wall with doing all kinds of study every day, like expect kind of 9 to 5 on most days for lectures, but they also disperse in the problem-based learning, which is like small group tutorials, which are really enjoyable because you kind of get to meet some of your colleagues, get to make friends. It's a good way to socialize. Some of my friends throughout the course I met basically on day one on PBF tutorials, and it kind of gets you thinking like laterally and how to discuss and see how other people think. And because there was quite a diverse range of backgrounds, like some of my friends come from IT, some in finance, they had very different ways of thinking, which sort of showed in the tutorials, which I liked. That was quite full on. That was like, I think twice a week we had. We also had anatomy, which was dispersed. I think we started using the 3D anatomy at the time as well. And there was a few days in the dissection room at the time. And again, we had clinical and communication skill sessions, which were taught by other students as well, which I like. So they kind of knew our way of thinking and had little tips and tricks for us when it comes to like how we should approach the exams and stuff. As I would say, because it's quite full on, the best way I kind of approached it was I tried to kind of do my notes as I went on. Otherwise, it will pile on. But if you do that, you kind of manage it and you actually find you have more time. So I was able to work a little bit during the years, and obviously it gets a bit more difficult when you have placement, but I managed to fit it in. So you can do part-time work if you wish as well. And then, as I said, as you go along, you end up having more placement, and you have to go out, and then your clinical work requirements kind of get on more and more. And now in final year, basically, it was a whole year of assistantships, which kind of gives you quite a lot of autonomy and independence. One I really enjoyed was my GP placement down in Croydon. I essentially got my own list every morning, 8:30 to 6 on the dot, and I accidentally agreed to take the emergency lists even more. So I was there until 7:30 every Monday. But it's really good because you get to actually exercise some of the skills that you have. You have supervisions from some really, really, really excellent GP and other consultants as well. And you get to kind of see what it's like for essentially when you work. And I feel like it's prepared me quite well for my job, which actually starts in about a month. It's quite daunting to think about, actually. Apart from that, I mean, it's all work and stuff, but it's really nice going to St George's because everyone's super friendly. It's a small uni, so you get to know a lot of people on other courses, and because it's all healthcare, they're kind of in the same boat, so they all have the same sort of struggles that you'll have, and you can kind of talk to them and see how they approach their courses and stuff too. And on top of that, just going around teaching. It's a really, really nice area. It's super sort of like diverse and vibrant, and the food is just basically amazing. If we weren't in uni studying and we weren't on placement, what you'd basically see us do, like me and my friends, would basically go to Tooting Market. There's always people giving out free food stuff. So we just keep walking up and down, sampling. That's basically your dinner as you come back. And then you'd end up in one of the pubs, which usually offers student discount or NHS discounts anyway. So it's I would say it's definitely worth coming to St George's. It's an enjoyable experience. I feel prepared for basically my work as a junior doctor upcoming now.
Great, thanks. Bex.
That's amazing. Yeah. So my name's Bex. Like I said, I'm currently a 4th year, and I come from the undergraduate program, so I came straight from high school. I'm also a home student. Unlike Ratna, I've been living in halls, and then I now rent locally. So I currently live about a 15-minute walk from campus. And I'm also within a 45-minute bus journey of most of the major hospitals that we have placement on, which is super helpful because it means I don't need to be worrying about leaving quite as early as Ratna would have needed to have done for some of her placements. So that's super helpful. I'm currently on a general surgery placement, which means that most days I'm in from about 8 o'clock until about 5 o'clock in the evening, helping the junior doctors with all of their jobs, going on ward rounds, doing all the stuff that you see kind of on TV, doing pretty much what you would expect from a medical student life. The first 2 years were a little bit more chill, a lot of academics still, but slightly less intense than the M4 program, thankfully. I could not do what those guys do. But again, there's lots of clinical placement really early on. So in addition to the GP placement that the M4s have, we also have 6 weeks of clinical placement spread across the 2 years. You have 2 weeks in medicine, 2 weeks in surgery, and then 2 weeks in radiology and senior health. And that's one of the main reasons why I chose St George's. I really like the idea of getting hands-on early, especially as someone who joined St George's during the pandemic as well. I hadn't had the opportunity to do work experience, and so those early clinical placements really helped affirm for me that medicine is what I want to be doing, that working on the wards is what I want to spend the rest of my life doing. And so that was really helpful for me personally to get me through the academics, which are quite hard in the first 2 years. It's a lot of science, a lot of biochemistry, but helped to really push me towards T year and P year, where we're now looking at more clinical stuff, and I'm able to go through the conditions list and work on clinical things, which is really exciting. Something else that I really enjoy about St George's is the research projects that we have the freedom to do. So I've just finished my 3rd year research project, and I was able to take part in quite a big audit as part of a clinical trial in obstetrics and gynecology, which is the field that I want to go into. So I was able to spend 3 weeks looking at some fetal medicine review and was able to hopefully help in the clinical trial that's going to be published soon, which is very exciting. And St George's have been super supportive in allowing time away from placement in order to be able to work on those projects and make opportunities to boost my CV later on. As Ratna said, tuting's a really lovely area. There's lots of different markets and stuff, which again, I also spend quite a lot of time wandering around looking for free food. As a student, you're never going to turn down free food. There's lots of different cuisines in Tooting Market. The other thing that's super helpful about St George's is it's right next to Tooting Broadway on the Northern Line, which makes really easy access into central London. There's so many things going on in central London all the time that you can always jump on the tube and go. There's lots of West End shows and all kinds of other things that go on all the year round. It also makes it really easy for socialising and societies. We've gone to various different things in central London as societies, which is super exciting. That's the other thing that I really like about St George's, and something that is super important, I think, wherever you end up at medical school, is to balance work and life. Work-life balance is something that you'll hear us harp on about a lot, and St George's are quite good at making sure that our welfare is in check. We have lots of different societies that you can get involved with. Myself, I'm a member. The main society that I'm involved with is Musical Society. We put on 3 different shows a year, and it's very hectic with uni to spend several nights a week rehearsing and then putting on a show, but it definitely helps with my mental health to make sure that I'm looking after myself and meeting up with friends every night to go and put on a show at the end of it. So I would really recommend getting involved with societies in order to balance your work and life. It can feel like you're run off your feet and you don't have anything to do except sort of study and sleep, but going to societies is really helpful and really important. It helps boost your CV as well if you're on a committee in the society. So this year I'm welfare officer for Musical Society, and it's really important to just make sure that you're getting out and making new friends and meeting people, which is really fun. I think that's about everything that I have to say. I don't know who I'm handing back over to. I think we have time for Q&A now. Sorry, I think you're muted again.
I said, yeah, I was just saying all 4 of us are about to be on screen, and here we are. So there was only one question in the chat, which I can see our other admissions tutor, Yao, has already answered. I let that run over very slightly, which is fine, because you guys are such fantastic advocates for George's and give us hope for the future. You'll be looking after me as I get older. If there are any other questions, we've still got time. We really are happy to answer anything you want to ask us. So I think you just post it in the chat and we're happy to answer it.
There's a question here, Hannah. How important are personal statements and
where are these? Are they not in the Q&A?
You have to click. Yeah, they're in the Q&A. You have to click new posts, and then the new ones come up. Otherwise, it doesn't show you.
There we are. So yeah. I've seen there's a whole load actually, isn't there? I can see them.
I can answer this one. So how important are personal statements in UCAT when applying? So personal statements we don't count as part of our admissions process. So we think it's a good exercise for you to go through, and it helps to kind of maybe gather your thoughts about things you could talk about in an interview. But we also know that people get a lot of coaching with personal statements, and so we don't score them. They're not part of our admissions process. UCAT's very important. So we rank everyone by their UCAT score for the 5-year course, and that's how we decide who to invite to interview.
Right. In terms of the other questions, I can see there's one of that minimum age to apply. You need to turn 18 by the time of your first clinical placement. And when that is depends. I mean, we're talking about the 5-year school theme here, so you need to be 18 by at the very latest early November. I think that's our first clinical placement, and you need to be 18 at that point. But I would say I would always encourage people not to rush to start too early. I'm a neurologist. Your frontal lobes don't fully develop until you're about 24 or 25. So you will have a better time on the programme if you're a little bit more mature and a little bit older. So we would always encourage people to defer rather than start very young. But that's the absolute sort of limit. In terms of how old students in general, how old are the students? Well, we don't have an age limit. It would be illegal to do so. It's very varied. I think we have a lot of graduates on the M4 programme who are doing it straight from their graduate degree. So they're starting the programme at 21 or 22. We have some others who've done a few years of work experience before they decide to come back and do medicine. We have a very small number who are much older than that and start much later on. So it'd be illegal to have an age limit. I would encourage people to think about carefully about whether you really want to be doing working a full shift rota as a junior doctor in your late 40s or 50s. Those of us who've already got there can tell you that you don't want to be doing that at that stage. No way would I want to be a junior doctor in my late 50s. And you have to bear in mind also that when you graduate, it's going to take you a minimum of another 5 years before you can be an independent practitioner. That's if you decide to be a GP. And if you want to work in a hospital specialist, it's going to take you about another 10 years. So you need to think very carefully if you're substantially older about whether that's really the right journey for you in terms of practicing. Okay, graduate entry, we've answered the question about personal statements. It's the same for both programs. Common accommodation areas. I don't know who's best placed to answer that. I mean, probably me, because I know most of our students. It's very varied. So we do have some students commuting from very far East London or Northwest London and who have family commitments there, which is why they don't want to move. It does make it more challenging because of you've got to be able to get to those further away placements. We do have an individual allocations process for students who are disabled, who are parents. They would be given preferential placements more locally. There's a range of criteria. So I would say it's extremely varied. We also have graduates who move very locally. We've had some students who've attempted to do the programme from much further afield, the Midlands or Nottingham, and that nearly always doesn't work out for kind of obvious reasons, I think. Will there be an increased number of places? So the number of places is nothing to do with the merger. That's controlled nationally by NHS England and the Office for Students. We have slightly increased numbers on the graduate programme for next year. I think we're going to have 71 places instead of 70. And we are bidding for more places, but most of the new places as part of the long-term workforce plan are not going to come to London schools. They're going to go to out of London schools and some of the newer schools, because that's where there's capacity to expand, and that's where we need new doctors. But that's independent of the merger. M4 international, we don't have any international students on the M4 programme. I think that's right, isn't it, Laura?
Sorry, could you just repeat that, because I'm just typing away in the Q&A.
The question is, I'm an international student and I graduated from a university outside of the UK.
Yeah.
Who wants to apply for M4? We don't have any international students on the M4
programme. For funding reasons, we're not allowed to have international students on the M4 programme.
And do we look at secondary school qualifications? Someone's already answered that, I think. Yeah. GCSE results. Can you see perhaps one of the admissions tutors, because that's a very specific question about grade 5 for English language, and then resat it and got a grade 7.
Actually, you didn't answer that question because I cannot remember whether we take resits for GCSE or not. Yeah. So have a look at the website, and if not, please contact the admissions team to ask them.
We can continue answering some of these questions in the chat at the end of the webinar. So I think because it's 5 o'clock, we need to stop the webinar, but we will